So we are going to see about the Pons, parts of the brainstem, medulla oblongata, Pons and midbrain. So this is the Pons. The Latin meaning of the Pons is a bridge that connects to the cerebellum. It is a 2.5 centimeter long and it extends from the cranial end of the medulla oblongata to the cerebellar peduncles of the midbrain. So we are going to see about the external features of the Pons, internal features by the cross section at the level of facial colliculus, at the level of motor and sensory nucleus of trigeminal nerve, and blood supply with applied aspect. So here parietal section of brain, brainstem, medulla oblongata, Pons and midbrain. Posterior to the rib there is a cerebellum. Between the cerebellum and Pons there is a cavity of the fourth ventricle that continues below with the spinal cord. Here the fourth ventricle that continues with the cavity of the midbrain. So Pons, it has the anterior surface, posterior surface, upper border and lower border, and it is a convex from above to downward and also from medial to lateral. So function of the Pons, it connects the medulla and midbrain. It transmits information between spinal cord and brain. It is a relay station for the motor information between the cerebral cortex and the cerebellum. So external features, it is a 2.5 centimeter long. It has a ventral surface and the dorsal surface. In the central of the Pons there is a groove. It is known as the basilar groove. And on the anterior surface or ventral surface, on the lateral part there is the attachment of the trigeminal nerve. The trigeminal nerve, medial motor root and lateral large sensory roots. And just lateral to the trigeminal nerve that starts the middle cerebellar peduncles. So here it is a superior border that continues with the cerebral peduncles of the midbrain. Inferiorly, inferior border, and at the junction with the medulla oblongata and Pons there is a 6th, 7th and 8th cranial nerve, attachment of the abducens nerve, facial nerve and vestibulocochlear nerve. So here the posterior surface of the Pons, it is a triangular in cross section, and each side of the median area there is a elevated part. It is known as the facial colliculus. Lateral to the facial colliculus there is a vestibular area, and above the vestibular area there is a corpus cerulans. Locus cerulans, it is a bluish grey area and it belongs to the reticular formation, and it is a reach into the noradrenaline. So posteriorly it is covered by the cerebellum. Between the cerebellum and Pons there is a cavity of the fourth ventricle. Here we can see the superior cerebellar peduncle, middle cerebellar peduncles and inferior cerebellar peduncle. This is the posterior surface, this one is the anterior surface of pons. So internal feature, cross section at the level of the facial follicles. So this one is the anterior surface and here it is a posterior surface. Pons, it is divided into anterior basilar part or ventral basilar part and dorsal tegmental part. So when in the ventral basilar part, it contains the longitudinal fibers, that is the corticopontine, corticonuclear and corticospinal fibers. So here there is a bundle of the corticospinal fibers that relays into the corticospinal fiber that continues with the medulla oblongata in the pyramid of the medulla oblongata. Here corticopontine fiber that relays into the pontine nucleus. These are the pontine nucleus, and pontocerebellar fiber from the pontine nucleus cross to the opposite side and reach the opposite middle cerebellar peduncle, and corticonuclear fibers that relays into the opposite cranial nerve nucleus. So we can see the anterior surface of the pons, there is a transverse striation. This transverse striation is due to the corticopontocerebellar fiber, pontocerebellar fiber. So here anterior part or basilar part, it contains the corticospinal, corticonuclear and corticopontine fiber and pontocerebellar fibers. Now the dorsal tegmental part, it contains the cranial nerve nuclei, grey matter, that is the cranial nerve nuclei, and in the white matter it contains the tract. In the central medial part, its side, it contains the medial longitudinal fasciculus. The medial longitudinal fasciculus, it contains the fiber from the vestibular nucleus and it contains the crossed, uncrossed, ascending, descending fibers of the vestibular nuclei, and it established a connection with the motor nuclei of the third nerve, fourth nerve, 6, 8 and 11 cranial nerve nuclei. So these fibers from the medial longitudinal fasciculus. Then the tectospinal tract, it arises from the tectum of the midbrain, and rubrospinal tract, it arises from the red nucleus of the midbrain through the spinal cord. On the lateral side, this elevation on the posterior surface, that is the facial folliculus. Here it is the abduction nucleus and here one is the facial nucleus. Facial nucleus lies ventrolateral to the abducent nucleus, and the fibers of the facial nerve that passes wrap around the abducent nuclei and then it comes out the anterior surface. This crossing of the fibers, it elevates the posterior area. So in early embryogenesis, this facial nerve nuclei lies dorsolaterally, but it winds around the abducent nucleus and comes nearer to the motor nucleus, nearer to the trigeminal nerve. So the facial nerve migrate towards the sensory nucleus, trigeminal nerve. It is known as the neurobiotaxis. So this is the example of the neurobiotaxis. So here it is abducens nucleus and the fiber from the nerve passes anteriorly to the abducens nerve. And most laterally there is the inferior cerebellar peduncle and ventral and dorsal to the inferior cerebellar peduncle. It is a ventral and dorsal cochlear nucleus. And just lateral to the facial follicles, here it is a vestibular area that contains the medial and lateral vestibular nucleus. And medial to the inferior cerebellar peduncle, there is a spinal tract and nucleus of the trigeminal nerve. In the anterior part of the tegmentum, there is a cross-striation of the cochlear nerve nuclei. So fiber, they decussate and it forms the trapezoid body. And posterior to the trapezoid body, in each side, there is a medial lemniscus. So medial lemniscus, that continuation from the medulla oblongata, and it contains the sensory decussating fiber and fiber from the anterior spinothalamic tract. And lateral to it is a spinal lemniscus. So spinal lemniscus is also formed by the fiber from the anterior spinothalamic tract. So these are the cross section at the level of the facial folliculus. Now the cross section at the level of the trigeminal nerve. So the same, it is anteriorly divided into the ventral basilar part and dorsal tegmental part. So ventral basilar part, it contains the same fiber that arising from the cortex of the cerebrum. So corticospinal fiber, corticonuclear fiber and corticopontine fiber. And from the pons, crossed opposite, that is the pontocerebellar fiber. So in the upper part, you can see the small cavity, that is the cavity of the fourth ventricle. And each side of the cavity of the fourth ventricle, there is a superior cerebellar peduncle. So the two superior cerebellar peduncle, it is breached by the neural tissue and it is known as the superior medullary velum. And anterior to the superior cerebellar peduncle, there is a trigeminal nerve nucleus. Medially, it is a motor nucleus, lateral large sensory nucleus, and mesencephalic root of the trigeminal nerve. This fiber passes anteriorly and it comes out through the anterior surface. So when we see in the midline anteriorly in the tegmentum, there is a trapezoid body. When we continue upwards, this trapezoid body would disappear and this fiber, it forms a tract, that is the lateral lemniscus. So lateral lemniscus, it is ascending pathway of the cochlear nuclei. So medial to lateral in the anterior part, there is a medial lemniscus, trigeminal lemniscus by the fiber of the trigeminal nerve, spinal lemniscus and lateral lemniscus. And on the midline each side we see the medial longitudinal fascicular, tectospinal tract and rubrospinal tract. In the superiorly above the vestibular area and lateral to the superior colliculus, there is a locus cerulans that contains the nucleus cerulans bluish grey area. So what is the medial longitudinal fasciculus? It is the ascending, descending, crossed and uncrossed fiber of the vestibular nuclei that established a connection with the oculomotor nerve, trochlear nerve, abduction nerve, vestibulocochlear nerve, and the 11th accessory nerve. So applied related to medial longitudinal fasciculus, there is the ipsilateral palsy of the medial rectus muscle, contralateral mononuclear horizontal nystagmus on adduction of the eye. Blood supply. So central basilar sulcus, it contains the basilar artery that is formed by the unions of the two vertebral arteries, and above at the superior border there is a branch arising, that is the superior cerebellar artery, and at the inferior border there is the inferior cerebellar artery, there is the anterior inferior cerebellar artery, and the pontine branches from the basilar artery, and venous drainage to the inferior petrosal sinus and basilar plexus. So listen, it is the cerebellopontine syndrome or pontocerebellar angle syndrome. It is due to the acoustic neuroma, that is the tumor of the vestibular nerve arising from the Schwann cell. So it compresses this area. So the symptoms, when it related to each nerve, persistent tinnitus, progressive deafness, nystagmus, nausea, vomiting and vertigo. Cerebellar lesion is tremor, ataxia and dysmetric, as it is related to middle cerebellar peduncle. When it related to trigeminal nerve, ipsilateral loss of pain and temperature sensation from the face, ipsilateral, and facial nerve, ipsilateral Bell's palsy, hyperacusis and loss of taste. And Millard-Hubler syndrome, it affects the these parts of the pons. It is occurs due to the occlusion of the foramedian branches of the basilar artery. So it produces the ipsilateral Bell palsy, hyperacusis, loss of taste. And when it involves pyramidal tract, it produces a contralateral hemiplegia. In the Raman syndrome, that is the alternating abducent hemiplegia, it also occurs due to the paramedian branches of the basilar party. So this part it is affected. So pyramidal tract is affected. So contralateral hemiplegia. In the sixth nerve is affected. So ipsilateral paralysis of the lateral squint. So internal squint. So here the sensory nucleus of the trigeminal nerve. How it is located? Nucleus of the trigeminal nerve in the brainstem. It supplies the sensory nerve supply to the facial muscle. Here there is a motor nucleus of the trigeminal nerve. It supplies the muscles of mastication, tensor tympani related to the ear, tensor belli palatine muscle posterior to the pterygoid plate, and anterior belly of the digastric muscle. So alternating trigeminal hemiplegia, this part is affected. So loss of pain, ipsilateral loss of pain and temperature sensation from the face, lower motor neuron paralysis of the muscles of mastication. And when the pyramidal tract involves contralateral hemiplegia. So that's about the pons.